Good day, everyone. I wanted to talk to you quickly about some audits that have been done on our moderate sedations. These get reviewed fairly frequently, and they're reviewed by our nurse leaders as well as anesthesia to make sure that we're meeting the requirements of providing that kind of service in our emergency department. So, I want to show you today a chart that actually has been done very well. Um, but also highlight some of the areas that got missed or some areas that could be improved. But in general, this is what you should be looking at when you're filling out your moderate sedation form. So the first thing, of course, is going to be the actual authorization for surgery or special procedures. This is actually pretty well filled out. A couple pieces here. They authorize the doctors who performed it and who they're performing upon, and then the specific procedure that's done. And in this case, it's the reduction of the right shoulder. As you work your way down, um, the case, we look at the consent and it is missing the allergy section. So we have to put something in here. Um, Number 5 is that they understand there are potential risks from blood transfusions. They have to accept that they will either have a blood transfusion or not. So you have to actually have them initial this. They also understand that during the course of surgery, there may be blood or body tissue. They have to address this. I realize it's not important in a reduction of a right arm, but this is the consent and it has to be filled out properly to be legal. Down here, you can see that they indicate this was a verbal consent because the patient could not sign. So they actually did a great job. They put the two witnesses, two RNs, signed this form with the time and the date that this occurred. So overall, very good, but we did still miss some stuff. Allergies and boxes 5 and 6 have to be done. So then we can move on to the next page, and that is the moderate sedation and local anesthesia record. So I want to draw your attention. This is actually pretty well done. Specifically here at ASA class, they filled it out. This patient was a pre-procedure ASA class 1. If you don't know your ASA class, you need to look on the back of that form and it looks like this. So you need to be able to say, are they a normal healthy adult? Are they a patient with severe systemic disease would qualify as a 3? Or is there a morbid patient that we're trying to do this on and they're not even expected to survive? So there's a lot of ASA classes that we may choose not to do these in the emergency department or with our providers. So once that ASA class is done, you have your pre-procedure assessment done and basically a pre-procedure set of vitals. So your baseline vital signs are here. The first line is your baseline. This is important because you need to get back to baseline in order for them to go. So while you're doing the procedure, you need to document every 5 minutes what is happening and their vital signs. This is done quite well. There's your 5 minute mark. The uh, whole procedure is completed. This is how much medication was given into divided doses. And then at the very end, you'll see about 15 minutes later, they actually are now back to pre-procedure vital signs and the discharge criteria is met. I love that they've also got your end title on here. This is a huge important piece as well. So you can see that they also clearly identify that discharge criteria are met and that discharge education was given. They placed a sling up here. Most importantly is if you're not familiar with our policy, you should familiarize yourself. Look up the moderate sedation policy, and it is on the internet. While it is quite long, let me get to the top of it, it's actually very educational. And so the moderate sedation policy is actually governed with minimal and deep sedation for all areas of the hospital is all in one policy. You can see here that they actually put it into a table and it tells you who's required to be in the room, the types of equipment and the types of medications that are approved for those. You can see right here, moderate sedation. Here's the type of dietary restrictions there are. This is the pre-procedure requirements for assessments. And here it tells you actually intra-procedure what you should be doing. You can see right here, every 5 minutes, you should be doing monitor vital signs. Um, this includes blood pressure, heart rate, respiratory rate, pulse oximetry, and in our area, carbon dioxide. Post-procedure, once you know to leave the patient, and every 15 minutes, you need to have a set of vital signs so that they can get back to within baseline. If you go down here a little farther, it goes through deep sedation as well. And you'll see that under deep sedation, it goes to every 5 minute, it has every 5 minutes as well. So not a big change. And then on post procedure, again, every 15 minutes until they're back to baseline. Goes through the types of meds that can be used under moderate sedation. And then if you like it written out here at the bottom under for moderate sedation, it'll literally tell you monitoring heart rate and oxygen saturations. And then the following items need to be monitored and recorded every 5 minutes or more frequently: blood pressure, heart rate, respiratory rate, and oxygen saturation, their responses to verbal stimuli or level of consciousness, and medications and dosages. So you can see on the one we looked at, very good. And then at the end, how do you show that they've recovered? And this is that post procedure recovery period. You have to have vital signs and oxygen that are assessed and documented every 15 minutes until the patient has reached functional assessment. So if they're there and you're done, then you're done. That's okay. I hope this helps, and please let me know if you have any questions. You guys have a good day.